Hello, I'm Greg Jamian, and welcome to Boomer Health at Home. As more baby boomers receive medical services at home, there are many questions that pop up that require sometimes quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donnellon. This is a show where we aim to deliver useful information to help you and your loved ones keep a nice, healthy lifestyle and concentrate on your health and well-being. Today, joining me is a registered nurse with Oak Med Nursing and Rehab, Joyce Ward. Joyce, thanks for being on the show.
Oh, it's my pleasure to be here. Thank you.
Well, great. Could you tell our viewers at home a little bit more about yourself?
Yes, well, I know I don't look it, but I have had 40 years of experience in the healthcare industry. I have been a bachelor's prepared registered nurse for the past 14 years. I have been employed with Oakwood and Beaumont. I have been an ICU nurse. I have been a home health care nurse. I have been a home health care nursing manager, as well as a case management manager. Most people know that as discharge planning. Prior to that, I have been a chiropractic physician since 1977. So I come with a variety, sort of eclectic background in healthcare. And I think an important one is I am now the primary caretaker for my 92-year-old mother who lives with me as well. So,
well, that's great. That's an extensive resume and very impressive. So we're happy to have you on the show.
Thank you.
Well, today we're going to talk about the number one cause of fatal and non-fatal injuries in the baby boomer generation today. Of course, that being falls. Joyce, what has been your experience in the field on this topic?
Well, falls account for a huge number of admissions to the hospital at the hospital level. Falls of themselves account for a lot of fatalities and injuries. They may not be the primary underlying cause of why the person fell in the first place. So I'd like to explore that a little bit as we talk. There are a lot of underlying health conditions that contribute to falls. And sometimes when a person lives alone, the family or those closest to that person don't notice the gradual onset of changes that are associated with aging.
Right. Well, yeah, and I guess that brings up a point. What are some things about falls that maybe the general public overlooks?
Well, the primary thing is that most falls are preventable. Just by surveillance and knowledge and information about the person's health status, their social environment, and their environment within the home. Some simple things could prevent most falls.
Yeah, that's something to consider. Now, when these falls happen, what is the number one risk, would you say, that within the home? That the fall itself, or do you...
Well, not the fall itself. It's usually you have to go through the home and you have to look for trip hazards.
Okay.
You have to look for the environment in the performance of what we call ADLs, or activities of daily living. Are they cooking safely? Are they bathing safely? Are they ambulating to and from the bathroom safely? And people, as they age, their number one fear is loss of independence and dignity. So oftentimes they will try and hide that from those closest to them. They don't want to be put in a nursing home or shut away or lose their independence.
Yeah, I've heard that, where if someone will tell a story, they'll say, hey, their loved one fell, but they didn't even tell me. I mean, I guess, could you emphasize the risk that someone takes by not reporting a fall?
Well, especially depending upon that person's underlying health conditions. For instance, if they're on heart medications or blood thinners and so forth, they could have an internal bleed, which could lead that could be serious, if not fatal. They could have fractures of bones. Many older people have osteoporosis or thinning of the bone structure, and they'll tend to hide those things from their family for the reasons that we talked about before.
Yeah, imagine. And sometimes, I mean, it's almost like socially embarrassing. I mean, a heart attack's kind of acceptable, but a fall could be embarrassing. But it's important not to let that to sway your decision to not report it or seek medical attention.
Right, right.
Yeah, so, well, that's very good. Now, with the people at home and maybe loved ones that are caring for people at home, I mean, you mentioned some of the fall risks. So what are some other things people should look for if they're concerned about their loved one?
Well, you should look for decline in vision, which can be very gradual and not even noticeable to the person that you're concerned about. Increased loss of vision, cataract formation may not even it's not a sudden onset, it can be very gradual. And people can adapt and try and hide it. Loss of cognitive abilities, forgetfulness, impulsiveness, not doing things safely, not moving safely. And in my experience, seniors can be very good at hiding those things at times. Confusion and so forth can be very gradual. And, you know, a number of things around the home, people may lose the ability to keep a clutter down, housekeeping and so forth, and they may not be doing things safely. A big one is driving safely, you know, and just moving about the home in a safe manner.
Right. Well, the main thing you said, too, is that the falls can be preventable, and I think in order to do that, we all need a little more education on it for us and our loved ones, and we would definitely want to hear some more information. So when we come back, we can talk about a little bit more about what family members and patients themselves can do to prevent falls.
Absolutely. Thank you.
Welcome back. Before the break, our special guest Joyce was talking about falls, what causes them, and the inherent dangers associated with them. Joining me is my co-host Brett Pulte, and we're going to discuss with Joyce some prevention methods as well as tips for your family on how to help loved ones that may be at a fall risk. Welcome to the show, Brett.
Thanks for having me.
So we were talking earlier about the different falls. Now, again, if you could just kind of touch on the topic again, what causes falls? What are some of the biggest risks in the home?
Well, one thing that we want to remember is that the vast majority of falls are preventable with some simple things. Number one, we have to look at the physical status of the patient. Are they weak? Are they moving well? And so forth. We can look at the home environment as very important as well. Are there cords from lamps? Is there too much furniture in the house? Are there throw rugs? Throw rugs is the number one problem with falls in the home. So looking at the bathroom environment particularly, oftentimes families will notice a decline in personal hygiene in an aging relative, and that's because they're afraid to go into the bathroom. They're afraid they're going to fall. It's a very dangerous, anxiety-provoking environment for most elderly people.
Right. Now, you mentioned earlier, too, that some of the falls are associated maybe with an underlying medical condition. What are some steps that an individual who may be afraid of falling could take to maybe just kind of assure their own safety?
Well, it's very important as a family unit that you have a good relationship with your personal physician. There are many underlying health issues that precipitate falls. Number one, loss of vision. There could be underlying diabetes, blood sugar regulation problems. There are millions of people in the United States that are diabetic and don't know it. And the most prevalent type is diabetes type 2, which is usually onset after age 50, even with no family history. So it's important that your doctor does regular blood work to look at that. Also, you have to look at foot health, degeneration of circulatory function, can cause problems with the feet. I mean, how often have any of us looked at our parents' feet when they get older? I mean, it's not something you normally do, but you should make a point to do that or have the physician do it. Congestive heart failure or decline in cardiac function can cause problems with either high blood pressure or low blood pressure. People will get dizzy when they first stand up because they don't accommodate to it. So you can see there are multiple problems. Cognitive abilities in order to think clearly, to move safely. A lot of times lung function declines, that you're not breathing well, you're not oxygenating the brain well, and you're not making safe decisions. So there are many facets to look at, which you should do with your healthcare professional and the family altogether.
And as you were saying earlier, another one of the big things is throw rugs. What about what people choose to wear on their feet? What would be a better option for someone who may have falling tendencies?
Well, first of all, you want to make sure that the footwear fits properly. If they're diabetic, they can't have the shoe or anything rub anywhere. A lot of times you can get prescription footwear that will do that. Make sure that there is a non-skid bottom on the shoe. House slippers and those kind of things, throw them out. They're just no good. So.
Well, yeah, and one of my loved ones, I had a great aunt who into her 90s still wore high heel shoes. I mean, it was just her style and stuff. So
yeah.
Eventually, actually, that's what we have to my right. We did get her a walker much like this. So instead of giving that up, have a device that can assist you, maybe a walking cane or a walker of that nature, just on hand. Just if the struggle is maybe some of the stuff like you're saying that they're wearing, have an alternative plan to kind of counter that to prevent falls while you're out. So. Yeah, this is a great device here that we're looking at. The one, it's got the seat, it's got the walker, it's got brakes on it, so it's good for all different weather patterns and stuff. So.
Yes, there are just a multitude of really wonderful products out there that can make the person safer in the home, but I have to stress it is important that you have a professional provider provide that equipment. If the equipment is not the right size, it's not appropriate for their needs, it can actually increase their risk factors rather than decrease them. And they have to be instructed how to use them safely. That's why it's a really good idea to go to a professional medical supplier in conjunction with your doctor to have them evaluate what your actual needs are in order to do it safely.
And just like you were saying, with every person has different needs for a product of this nature. I've had family members in the past. We bought just the standard walker of this nature, and it didn't fit their needs because they were a bigger person.
Right.
We weren't even aware there was a bariatric one until we talked with someone.
Yeah, it has to be able to support their weight. It has to be at the right height, and they have to be instructed into how to properly use it. Right. So it's very important that you do that with a professional.
Yes, and I believe you had mentioned the risk within bathrooms due to the environment and slippery. It looks like we have some products here that is a great example of what she's talking about, with having professionals come in, evaluate it, and professional grade, professional installation. These are some great things to think of. People wouldn't really think about a different shower head, one that's actually more pliable, so to help with the bathing aspects of it. So that could definitely prevent some falls and at least make it a little bit easier. So.
And I know that you did touch on some medical conditions that could cause a person to be a fall risk. But what about their medications?
Polypharmacy is what that's called. People go to different doctors, they get multiple medications, sometimes duplicate medications. The medications can affect the blood pressure, which can precipitate falls. Pain medications, we're now in the opioid crisis, is a terrible drug problem to have amongst our elderly population. They're over-medicated, they have duplicate medications. It's vitally important that you have the medication reviewed with your doctor, and it's vitally important that you go to a single pharmacy so that they can monitor the intake and make sure that duplication or over-medication is not a factor, which is a huge problem in precipitating falls.
Great. Now, in your professional experience, you've worked in the homes, you've worked in the hospitals. Well, we have viewers all across the country, of course, and maybe they have loved ones here in the state that they worry about, but they can't necessarily be there 24/7. What advice could you give to them?
Well, most people don't realize until they reach that point in their life that home health care is a covered Medicare option. You don't necessarily need to have been in the hospital in order to, or had surgery or anything like that to be prescribed home health care. You can get that prescription from your doctor, okay, and you can have a physical therapist or occupational therapist or a home health care nurse come directly into the home and evaluate the home environment, the medications, the functioning, the ability to move, the cognitive function, and put a good care plan together for that. Out of state, I know it's very difficult. I fortunately have my mother living with me, so I can oversee her care. But in today's society, we're mobile. People move all over the country for jobs, and adult children many times live all the way across the country. In those cases, there are home health aides that you can get for as little as $80 a week to come in, make sure the parent is bathing, make sure they're eating properly, make sure they have groceries. And it's much more affordable than people think, and that keeps an open line of communication with those adult children in order to come up with a good transition plan and allow them to age in place and stay in their homes for a much longer period.
Well, that's some great advice. I mean, we're going to take a short break, but when we come back, we'll discuss some more advice that Joyce has for the family member looking to care for a loved one. Don't go away. Welcome back. So Joyce, the main thing I think we need to kind of consider when you do have a loved one, it's a delicate subject. It's tense. How do you recommend we go about approaching a loved one that we think may be at a fall risk?
Absolutely. In the process of aging, it's really a role reversal of the parent-child relationship. You're actually trying to parent your parent, and sometimes it is not well accepted. Based on my personal experience, the best advice that I can give you is not to come in and try, you're going to do this, you're going to do that, we're going to change your living environment. The person will become very anxious. They need to feel like they have some kind of control over their future, their living situation, and their life, and it may not be well accepted. Have a low stimulation environment to sit down and ask, some leading questions, discuss, what do you think? Allow them to feel like they're having some input into decision making about home environment, equipment, and so forth. Or you may run into a very anxiety and angry parent at some point if you don't try and allow them that dignity.
Great.
And that's, dignity is so important for any person. So, keeping that in mind, now what are some tips that you would have for family members that might be, worried about a loved one that has a fall risk?
Right.
Yeah, how do you recognize it, I guess?
Well,
right?
people can be very good at hiding problems, especially, in the aging process. It's complex and layered and very gradual and insidious at times. You have to kind of look for, a lot of times, long-term memory stays intact, but short-term memory does not. And you'll start to notice a few things, word finding, not being able to find items put in odd places. You kind of need to watch for social isolation and withdrawal. A lot of times parents, you'll find a parent fallen in the home or so forth, and they don't tell you about it, and I didn't want to bother you. So you have to be direct about those things, and definitely have that social contact and be able to watch for these signs within the household and within the individual themselves.
Sure, yeah. I imagine hearing that any change in their regular routine could be a warning sign that maybe they, like we talked about earlier, had a fall and they're just not maybe they're injured at home, you don't realize it. So I think it's crucial to pay attention to what's going on.
Right. One of the biggest fears of elderly people is, oh my gosh, they're going to put me in a nursing home and I'm never going to get out, and that causes a lot of anxiety, and you just kind of have to be gentle. You may have to repeat things several times, but try and let them feel that they're having input into it and helping draw them to a logical conclusion about what is the best course of action to take.
Now, like you said earlier, hiring a home health company can definitely help. What type of medications are available to make in the home to make things a little easier, less risk of falling?
Well, there's definitely look at the bathroom environment, make sure they have tub benches, grab bars, those kind of things. Again, we covered the throw rugs, the cords. Then there's a lot of services available. There are some excellent companies that can provide home companionship, home health aid, for actually a relatively small amount of money. Especially most adult children work. They're taking care of children, grandchildren, and so forth, and can't come 3 times a week to give a bath and those kind of things. So there are many services available. You can, in Michigan, especially Southeast Michigan, has the Senior Alliance, which has a website with many resources, and there are several excellent companies available that are certified and provide excellent home health care needs.
What's your experience with you see the commercials for the medical alert devices and stuff of that nature? Do those help out once they're in the home, or is it kind of?
Absolutely. They've been documented to save many lives, and it gives peace of mind to both the family and the adult person, and allows them to live by themselves for a longer period of time within the home. So, and there have been many technical advances with the home alert systems in the past couple of years as well.
And that's one thing I've been noticing with family members of my own family, is that it's not just a pendant that you wear anymore. I have family members that have one, it's a bracelet that they wear, still has the same button and everything that they need, and now they're starting to be able to use it with a cell phone rather than just a landline phone.
Right.
Which, like you're saying, the advancements in technology are amazing.
They are.
And it's great to see that they're actually making a huge benefit to people's health.
Absolutely, yeah. They're so advanced now. They can detect a fall as opposed to somebody lying in bed and so forth. And they're really excellent devices.
Yeah, they'd be good, because I know a lot of. We always prepare almost for the home. We talked about the home, but a lot of the falls happen while the person's out gardening or stuff of that nature. How do you promote safety when they're out of their environment, I guess, is a question.
Well, a lot of the monitors are now tied to Bluetooth phones and so forth, and they have the ability to call help no matter where they are. So it's an excellent device. But as a healthcare professional, you probably want to, this is what we ask when we're thinking our family member's having a problem. Ask, have you or your loved one had a fall in the past year? Do you feel unsteady when standing or walking? And do you worry about falling? If you answer yes to any of those 3 questions, your risk for falling is greatly increased. And a fall definitely increases substantially your risk of dying within the near future. So you want to do everything you can to prevent those falls. Once you lose mobility from a broken hip or arm or back from a fall, which is easy to do if your bones are thin and brittle, it tends to precipitate a downward decline. So it is vitally important that you do these assessments to make sure your loved ones live healthy and happy lives.
Great, and I think that will help kind of cut some of the awkwardness of approaching it. Those 3 questions are pretty easy to ask, and it's saving lives. So it's something needs to be addressed, and preventative measures seem to be the best thing. And like you said, the falls are preventable. So
Absolutely.
well, good. Well, we really appreciate you coming on the show. You've shared a lot of great insight. Brett, thank you for coming on the show as well.
Oh, thanks for having me.
If someone has any more questions, can you be reached? Is there a phone number they could call you at?
Yes, I am the Care Transitions Liaison for Oak Med Private Duty Nursing, and we can be reached easily, and I don't happen to have the phone number.
Oh, that's right.
with me
We will
here,
share
but
it. We will share the
up
phone
on the
number too.
website. Yeah, and we have a full staff of nurses and medical professionals that can answer any of these kind of questions and would be happy to assist you at any time.
Great, and likewise too, if you have any feedback or have any questions about any of the content on the show, or even maybe suggestions for topics you'd like to see covered in the future, we'd love to hear from you. You can call us at area code 248-228-2270. Thank you for watching and have a great day.